I was thinking about what's an opportunity that I could have to help people understand information. What's another kind of latent body of information that's out there that people are really not putting to use? And so I came up with this: lab test results. Blood test results are this great source of information. They're packed with information. They're just not for us. They're not for people. They're not for patients. They go right to doctors, and God forbid, I think many doctors, if you'd really ask them, they don't really understand all this stuff either. This is the worst presented information. You ask Tufty, and he would say yes. This is the absolute worst presentation of information possible. What we did at Wired was we went and I got our graphic design department to reimagine these lab reports. So that's what I want to walk you through. So this is the general blood work before, and this is the after. This is what we came up with. The after takes what was 4 pages. That previous slide was actually the first of 4 pages of data. That's just kind of the general blood workup, right? It goes on and on and on. All these values, all these numbers, you don't know it. This is our 1-page summary. It spools out everything in we use the notion of color. It's an amazing notion that color could be used. So on the top level, you have your overall results, the things that might jump out at you from the fine print. Then you can drill down and understand how actually we put your level in context, and we use color to illustrate exactly where your value falls. In this case, this patient is slightly at risk of diabetes because of their glucose level. Likewise, you can go over to your lipids and again understand what your overall cholesterol level is, and then break down into the HDL and the LDL if you so choose. But again, always using color and personalized proximity to that information. All those other values, all those pages and pages of values that are full of nothing, we summarize. We tell you that you're okay, you're normal, but you don't have to wade through it. You don't have to go through the junk. And then we do 2 other very important things that kind of help fill in this feedback loop. We help people understand in a little more detail what these values are and what they might indicate. And then we go a further step. We tell them what they can do. We give them some insight into what choices they can take, what actions they can take. So that's our general blood work test. Then we went to a CRP test. In this case, it's a sin of omission. They have this huge amount of space and they don't use it for anything, so we do. Now the CRP test is often done following a cholesterol test or in conjunction with a cholesterol test. So we take the bold step of putting the cholesterol information on the same page, which is the way the doctor is going to evaluate it. So we thought that the patient might actually want to know the context as well. It's a protein that shows up when your blood vessels might be inflamed, which might be a risk for heart disease. What you're actually measuring is spelled out in clean language. Then we use the information that's already in the lab report. We use the person's age and their gender to start to fill in the personalized risk. So we start to use the data we have to run a very simple calculation it's on all sorts of online calculators to get the sense of what the actual risk is. The last one that I'll show you is a PSA test. There's the before, and here's the after. Now, a lot of our effort on this one, as many of you probably know, PSA test is a very controversial test. It's used to test for prostate cancer, but there are all sorts of reasons why your prostate might be enlarged. And so we spend a good deal of our time indicating that. We again personalize the risk, so this patient is in their 50s, so we can actually give them a very precise estimate of what their risk for prostate cancer is. In this case, it's about 25% based on that. And then again, the follow-up actions.